We talk about how to manage this situation from both perspectives. They've got the law enforcement criminal perspective, and we're coming from risk management, behavioral health background, and so we're able to combine those two to best support somebody in crisis. The transition, we were with a community mental health agency and now have brought the program in-house. Our wonderful supervisor, Julie Jacobs, helped negotiate and implement that. And I think it's increased our ability to communicate with the Sheriff's Department and model our application of care directly to the community, because we have this leadership team now at the Sheriff's Office. There hasn't been a huge change in the way we're providing care. It's just kind of been our command change now internally, being through the Sheriff's Office. We communicate with command staff there, and they're able to communicate things out to deputies quicker than, say, going through a mental health agency to have that happen.
When you have two separate entities with two different needs, you have the police department, you have a community mental health agencies, we all have different goals of what we want the program to look like. And you also have a community mental health center that is bound by patient confidentiality, HIPAA, different rules and regulations than what we are bound by here in the with our program now. So being able to bring it in-house allowed the communication for myself and the deputies to improve with the co-responders. So now we can talk, we can be proactive, we can create the CIT plans. When we have the high utilizers, using up our resources and calling 911 multiple times, we can get in front of future contacts and develop a plan of how deputies can respond on scene if a co-responder isn't available, the next steps a co-responder would take, the 14th, 15th time that we're called out to somebody.
You remember these two from earlier talking with them? Yeah. Are you doing okay?
Well, first of all, just showing up in civilian clothes helps individuals in crisis identify with maybe somebody who's not in law enforcement, or if law enforcement is triggering, they're able to divert their energy a little bit. And then we bring a really specialized skill set when it comes to crisis intervention, behavioral health intervention, helping keep individuals calm while on scene when they interact with deputies. And then most of all, we're providing like a behavioral health resource or some type of intervention to help direct somebody into something that might benefit them long term, instead of just in the moment. Just the way that our culture is moving, mental health awareness is a big piece of life now, and there is a mental health aspect in every single call that comes through our 911 dispatch. So it's helping create this awareness in the community that mental health will be a part of these calls, and sometimes it's better treated when you can have someone specialized in mental health resources to be on scene. So, yeah.